So now we're going from the big cities of Beijing and Shanghai into the rural community. And we're just going to have a slightly different slant now to actually look at COPD in a rural community. And so I'm delighted to actually fly from China to Egypt. How long would that take? I don't know, a long time. But so we're now going to have a presentation on the rural environment and the effect on patients with COPD. So where is my wonderful speaker?
Morning, everybody. Still morning, not afternoon yet. Thank you, Monica. Actually, it's a great pleasure and honor to be here. So I thank the organizer of the second COPD Global Patient Leadership Summit for inviting me. I'll go for the other face of the coin. The former presentation was about COPD in urban. I will give the other face of the coin. Everybody in this room realized that COPD is an important public health problem. Nowadays, it's still the fourth leading cause of death worldwide. It's expected after 5 years to be the third cause of death. Often, the prevalence of COPD is directly related to tobacco smoking. Although, in many countries, outdoor, occupational, and indoor pollution, the latter resulting from burning of wood and other biomass fuels, are major risk factors. Nearly 1/2 of the world population continue to be exposed to biomass smoke during cooking or heating with solid fuels. This exposure is most prevalent in less developed countries and rural areas. Biomass fuel combustion significantly contributes to our very important disease. Rural women in developed countries like my country bear the largest share of this burden, resulting from chronic exposure to biomass fuel smoke. As a public health problem, COPD caused by inhalation of smoke from burning solid and fuel is as prevalent as COPD caused by smoking tobacco, but mainly affects women and children from disadvantaged areas and countries and require organized efforts for its control. Still, few studies have attempted to assess COPD prevalence among non-smoking rural women in developing countries using primarily biomass for cooking. This is limited available information in my country, I think in many countries, on the prevalence of COPD in relation to biomass fuel smoke. Thus, it seems appropriate to study this subject. Any evidence for that? When you go through the internet, just write biomass fuel, COPD. Many research. I will give you only 5. Just the title and the conclusion for everyone. Biomass fuel are the probable risk factor for COPD in South China. We have colleagues from China here. What is the conclusion of this research published 2007? Indoor pollutants from biomass fuels may be an important risk factor for COPD in rural South China. 2011, prevalence of COPD in rural women from Tamil Nadu, implication for refining disease burden assessment attributable to household biomass contribution. The estimated generated in this study will contribute significantly to growing database of available information on COPD prevalence in rural women. Moreover, with concomitant indoor air pollution measurements, it may be possible to increase the resolution of the association between biomass use and COPD prevalence, and refine available attributable burden of disease estimates. What more? 2011, prevalence in COPD in rural women, 2013, effect of biomass smoke on COPD in rural localities of Colombia. Conclusion, replacing biomass fuel by natural gas may be an important public health intervention in Colombia because it can reduce the prevalence of abnormal pattern of pulmonary function. Any more? Association of biomass fuel smoke exposure and COPD in women of rural India, a cross-sectional hospital-based study. Study showed that risk of COPD increases by the constant exposure of biomass smoke in under-ventilated houses. It was also found that the severity of diseases also increases with duration of exposure. Lastly, last May, ATS, American Thoracic Society Congress, I was there, I'm a member in this recognized society. It was in Denver, Colorado. Group from Johns Hopkins School of Medicine, Baltimore. Very alarming conclusion. COPD is more prevalent in poor and rural areas of the US. Living in rural area and being poor are risk factors of COPD. That's why in Egypt we have just started a project, and I will take the opportunity being here with such distinguished colleagues to ask you if you are impressed by our project to go back to your country, encourage whoever responsible, and maybe we can put that under sponsorship or auspices of COPD Patient Global Summit to carry research for COPD in rural area, non-smoker women still using biomass fuel. Our project looking for the prevalence of chronic obstructive pulmonary disease among non-smoker rural Egyptian women exposed to biomass smoke. We aim to estimate prevalence of the disease among non-smoker rural Egyptian women exposed to biomass fuel smoke. Just to give you a short idea about the subjects and design, I'm not going for details. Study subjects recruited will include rural Egyptian never smoked females having history of biomass exposure, cooking with biomass more than 1 time per week during the last 5 years, with an age range between 40 and 60. These women should not have any other medical problems like asthma, like lung fibrosis, heart failure, etc. Sample size will be statistically calculated for the study based on the expected prevalence of COPD for women in Egypt. Because we have a study, which is the best study, published in Respiratory Medicine Journal, 2012. It was about the prevalence of COPD in 11 Middle East countries. The prevalence was about 3.6, but the sample were 40 and older. All are smokers. In this study, we didn't look for the non-smokers. So, dear colleagues, Ladies and gentlemen, I think we have to remember that inhalation of biomass fuel smoke is affecting mainly women in rural areas to whom domestic activities are usually assigned in developing countries, adding to the burden of poverty. Such projects like ours, and I hope there will be projects in every part of the world, will provide valuable missing data on prevalence of COPD among non-smoker rural women exposed to biomass fuel smoke. Is this important? Sure, because study results may be helpful in future implementation of intervention aiming to reduce or eliminate biomass fuel smoke exposure, and this, of course, will decrease the COPD burden. Thank you so much for your kind attention.